Hello, my dear friends. This is Dr. Suresh Shenvi from Aspire32. We have been doing lot of podcasts, educational videos. I welcome Dr. Jacob, prosthodontist from Bangalore, with a lot of experience in academics as a clinician. And today's topic is more about why the academics need to change, and we are getting a clinician's perspective on this topic. So, without a delay, welcome to this podcast, Jacob sir. And you may not remember that I have met you long back in a lecture. It's a 3M symposium, and it used to happen in Bangalore. And I think I attended
Oh, the
your
PG
lecture once.
symposium.
Yes,
Ah,
yes.
yes.
So that is how I remember you, and it's a pleasure to talk to you today. You have 40 years experience in dentistry. You are almost 60.
I am 60.
You are 60. So there is a lot to learn from you, and of course, we have a lot of time.
Yeah.
The first question being that how does it feel looking back 40 years into dentistry? What was your experience? How does it feel today?
Oh, so first of all, thank you, Suresh, for inviting me, and it's an absolute pleasure to be here. So looking back at my journey, I can't believe it's 40 years now. And it's been a great journey. Of course, there have been a lot of hurdles in the middle. Um, you know, we all look at somebody who is come up, but then we rarely look at the journey that they have actually gone through. So my foray into dentistry was actually because of an orthodontist, actually, the late Dr. Ramanand Hegde, who was my orthodontist way back in the 70s. And of course, I had no clue what I was going to do. And I did get into dentistry because one of the reasons was him, but of course I didn't become an orthodontist. A lot of youngsters nowadays, I feel, get into dentistry because they don't get into medicine, and that is one of the worst ways of doing it. The reason I got into dentistry was because I love machines, and I realized that I wanted to be working with machines, but I also wanted to be with biology. So this somehow came together. And of course, I started my journey in dentistry at Manipal. And it was a great experience in Manipal. We had some brilliant teachers, who were very ethical and who really taught us well. Um,
So
and then,
you were from Kerala.
yeah, I'm originally from Kerala, but I
Okay.
was born in Dehradun because
Oh,
my
okay.
father was in ONGC. And then I shifted to Bangalore in the late 70s.
Okay.
So I've been in Bangalore I went for studies here and there, but I've been in Bangalore since 1977.
So you were working in Manipal for some time,
Yes.
and you did your UG there.
Yes.
But I also know from your resume that you went to USA and
Yes.
UCLA. You did your fellowship.
Yes.
How did that start? Did you do it after your your PG, or did you go after your undergraduation?
So after my undergraduation, and a lot of students will not know this, a lot of youngsters will not know this, that I actually failed in two subjects during my undergrad,
Okay.
in surgery and in perio.
Acha, why is that? Was it because it was difficult, or
I wasn't a bad student,
okay,
but my handwriting was terrible.
okay,
And so actually my examiners, some of them actually made me write in capitals. So the reason I'm bringing this up is that, failing in final year devastated me very badly.
okay,
And I really didn't know what I would do next, because my idea was to go to the US after my undergrad to do my prostho in the US.
okay.
But because of this problem, I didn't get admission anywhere.
Mm-hmm.
And so I went and I did my prostho at Annamalai University. And of course, Professor Sham Singh was my teacher and he helped me a lot. But I never forgot that I wanted to go to the US. So I started my teaching career at Ambedkar Dental College, and I taught there for 6 years. And during that time, I met Dr. Bumer in a CD program in Chennai, and I told him I wanted to come there to UCLA. So I organized. He organized and got we got a visa, and I went there for 3 months, just as a visiting faculty. And then when I was there, I spoke to him and I said I want to learn. I actually wanted to go for implants initially. I had no intention of doing maxillofacial prosthetics.
Okay.
But then he told me that there is this Audrey Fellowship. It was at that time only given to surgical oncology specialists, and he said we will try and get it for you.
Okay.
And so we applied for it, and I got that. Um, the only condition was that I come back after I finished my program, and so that's how I went to the US, and that's how I came back. A lot of people ask me why I came back. One of the reasons was this, of course, Dr. Bumer, my professor there, was, if you told him something, you had to do it.
Mhm.
So if you told him,
he was a very strict teacher, or
he was strict,
Mhm.
but he was also a phenomenal teacher and a mentor. He was very old school. I still don't call him John or anything. I still call him Dr. Bumer. So he was very old school.
Mhm.
But he was a phenomenal. He actually taught me how to teach. He and Dr. Ted Berg. Ted Berg was in removable, and Dr. Ted Berg actually took my hand and taught me. I was so scared of doing cast partials,
Hmm.
because we're not trained very well here. And he actually took my hand and taught me how to do a cast partial properly.
So that is what is the topic today, because you said, see, in spite of doing all this post graduation, you have been a teacher.
Yes.
After your undergraduation also, then I'm sure that again after post graduation you were a teacher for some time, and you told me that you are a faculty till 2022. Of course, in that you were for some time you were a full time, then you were visiting. But why is that? You today in India, after, I'm sure that I finished my post graduation in 2012.
Yeah.
I remember it was in 2010 Bangalore, that 3M symposium. You were giving a lecture, and that time you first started asking, I want to know each of you, so you tell me your name, and first letter you should tell something about yourself. So I started saying that I am Suresh, and S represents sincere, because I was a very sincere student. But after that, I finished my post graduation from Courts Davangere. And what I have realized that there's a lot of change what is needed, because precisely that is what troubles me today, is that as a teacher after 13 years experience, that even after all this teaching, there are some parts where our students are not confident enough, and you felt it that time, it's that time you are feeling it. It's 20 years later also, we are putting students in the same situation. And when I saw your reel which you had posted, with so much of sadness, that you said nothing has changed in academics, uh, I felt maybe I should call you on this podcast and discuss this topic. Of course, it's a very sensitive topic.
Yes.
I understand the organizations, educational institutes, teachers have a lot of difficulty when it comes to bringing change. But your thought, that is what I wanted to share. So you went to US, and you told me one very important thing, that he taught you holding your hand, doing that cast partial denture. Why is that we don't do here in our college? It is that we want to teach theory to the students, and when it comes to practice, most of them, they are either learning from the seniors, or they want to do it on their own. Is there a lack in the motivation of the teacher, or this whole things has to change?
Again, as you said, this is a very controversial topic, but I am going to put out the views that I think need to be out there. I think to be a teacher, you need to be passionate about teaching. If you don't have the passion, then it won't happen. You will not be a good teacher.
Okay.
A teacher needs to be tough, very tough with the students. But at the same time, the boundaries that I put for myself when I was a teacher was I never looked at the private life of any of my students. It's none of my business. So what is there between 9 to 4 is what I'm involved in. What is after that is none of my business. So that is a boundary that I put for myself. That is one thing. Secondly, I think it also depends on the number of students that you have. So when I was a BDS student, there were 35 people in my class.
Yes.
Now you have that many PGs in some institutions, if I'm not wrong.
Correct.
Or close to that number.
Yes.
You cannot have 100 students and then it's impossible for any teacher to be able to guide that many students.
Absolutely. The student-teacher ratio really
Yes.
matters. Yes.
To me, and even when I was a PG teacher, the maximum PGs that I had in my program were 3. So I could give them enough number of time. I feel 2 is the ideal number. You can really give them time.
2 per teacher.
2 per teacher.
Okay. Per year or overall 3 years?
See,
like every year there are 2. Let us assume.
So maximum of 2 every year.
Okay.
Of course, as one person you cannot. You have other teachers along with you. But and also it should be topic specific. Now, one thing that I would really like the change to happen was what again, when I keep bringing up UCLA, it shouldn't be that I'm trying to bring down education. That's not the point. The point is I'm just trying to interject what can happen.
Correct.
That we had a couple of full-time faculty. The rest were all part-time. So I had, faculties who would come in and teach you a topic. So somebody was good in cast partial, so they would come in. Somebody was good at fix, so they would come in. These are all private practitioners, but they were all phenomenal teachers. So they would come in, teach half a day and go.
Okay.
Or teach one day and go. Most of them would come in 2 half days or something like that.
Yes.
So I know for a fact that there are so many good teachers out there who want to give back, who want to teach, but do not want to do it full time. And it's time that we actually looked at those teachers and brought them. Let them come, let them do that teaching. Compensate them well for their time. And let the students get the benefit of that. I think most of my career, I used to go 2 days a week. And I think the teaching was enough that they had enough time to do what I asked them to do till I come back the next.
Correct. So there was a follow-up.
Yes.
It was, you were following them every week.
I never, what I did not want to do is go somewhere, or I have gone to places like Bagalkot where I used to go 3-4 days and be there and then come, because it's difficult to travel that much and come.
Okay.
But I was always interested in teaching the student. A lot of good teachers have given me the knowledge that I have. And because of that, I want to share it with the next generation. Where am I going to take all this knowledge and go?
Correct.
It needs to come, especially in maxillofacial prosthetics. We have right now only 2 centers in India who have a fellowship program. One of them is in Amrita, where Dr. Bumer actually funds that program.
Okay.
And there's one in Tata Medical Center in Mumbai. These are the only 2 places. We have the highest rates of oral cancer in the world. And we have very few people who are willing to, who are trained in this specialty.
Is it wrong to be a full-time faculty in a dental college?
Absolutely not.
Or why is that the good teachers don't want to be in academics today? Like, what is stopping them from joining academics? Because as you said, there are good clinicians
Yes.
who want to teach
Yes.
but don't want to be a part of academics. One reason may be finances, right?
Yes,
Because see,
absolutely.
that can't compensate. You know the status of dental
I know.
colleges
I know.
and the financial benefit in majority. There are colleges where the payment is not done faculty. So
Yes.
it is for someone who is a young teacher who joins, finances being a very big import. I understand the passion is very important,
Yes.
but at one stage, maybe for them the finance also is important, and that is why teacher today don't want to join academics. Good teachers, or maybe someone who will excel as a good teacher,
Yeah.
but don't because of this reason. So how do you? Is that the solution, that getting teachers only part time? Do you see that is the only solution
No.
henceforth?
That's not what I meant. I meant there must be a few full-time faculty. That is very important because they have to run the department. You know, administration is a very big part.
Correct.
Now, I'm somebody who actually doesn't like administration.
Very true. I also don't
Yeah.
like it.
So I'm not great at it.
Correct.
I have been put into the situation where I have been head of the department, but I have really not liked it.
Correct.
My job is to come in, train the students, and leave.
Yes, because that's what matters
That
for
is
you.
what me. So I'm not saying that full-time teachers are not important. Of course, full-time teachers are important. And I'm sure full-time teachers, nobody can be the best at everything.
Very true.
Even in prostho, there are so many subspecialties. I can't say that I'm a master in everything. So I'm saying bring in the masters. Yes, the financial compensation is a big part. When I started my career, the good things with being in a teaching institution were, number one, financial security.
Very true.
And number two, we were given adequate amount of clinical work there as a faculty. The sad part now is most of the time you are doing, if you're a junior faculty, you are doing a lot of paperwork. And this is, I've spoken to a number of youngsters, and you get very little, see, as soon as you pass your PG, you have only started your learning process. That is what a lot of youngsters should realize. That is just your starting. Even now at this stage, I learn something new every single day. And
Correct.
that is the key. I have told myself the day I stop enjoying what I do, when I take an impression, I'm like, oh, wow, this is a fantastic impression. The moment I stop having that is the time I should pack up and leave. So this is the problem now. Youngsters, a lot of youngsters reach out to me and say, sir, the salaries that are offered are really bad right now, especially youngsters in colleges and even in private practices. And that's a very sad thing, actually. As senior clinicians, we should be offering better salaries to our youngsters.
You told me this one important point just now, that your learning, starts
Yes.
after post graduation. Sir,
Yes.
I would like to tell you a very important quote which I wrote.
Yeah.
It's called, I have written it as your real post graduation starts after post graduation. So this realization happened to me is that I finished my post graduation. I'm an endodontist.
Yes.
And cons and endo, as you know that
Yes,
when it comes to cons and endo, it is highly focused on endo. And sometimes, I have arguments on social media where some other branch people say that, ortho requires more time. Everybody else, all other branch can be learned in 3 years, but ortho cannot be learned, or prostho cannot be learned, implant can't be learned. I personally feel as a teacher, there is, in every branch, there is lot to learn. But when you speak of cons and endo, what everybody thinks that you are just learning the endodontics, and that is why that 3 years is sufficient. But after 13 years of my time as an teacher, I feel that there are so much to learn in cons and endo. Cons itself is that in foreign countries,
it's separate.
restorative, it's a separate branch.
Yes, absolutely.
Right.
Yeah.
So, but again, coming back to that point which you said that we have to learn many things after post graduation. Why is that? I personally feel, if you ask me, we are so much concentrated on asking students to read books, which is not a bad
It's
part.
not a bad thing.
Read books,
Yes.
okay, and present seminars,
Yes.
okay, and many colleges,
Yes.
present seminars. JCs are good because you are actually
Yes.
thinking,
Yes.
you are analyzing why. But you know, you see the younger generation of students who know that rather than making their own PPT, I can just take a PPT
Exactly.
which is already, which is, I sometimes feel is not wrong, because if there is a PPT which has all the slides, okay, why should I start putting my time and again making a new PPT? Instead of that, I can just focus on what is new, right?
Correct.
Because I can really focus
Yeah.
on it.
Yeah.
But that doesn't happen in many institutes. We are still there in that old thought process. If you ask me today, sir, I'm 40 today.
Yeah.
I'm 40, and trust me, I recently lost my father. I have realized
Yeah.
time goes very
Yeah.
fast. We
Absolutely.
don't have limit on time.
Correct.
So lifetime is limited. I realized today the role of the teacher with all this chat GPT technology coming in the picture. Today, the main goal of a teacher is to only save the time of the student. I feel as a teacher, something what he will realize after 5 years, my duty is to make him realize it during the post graduation, so that he can reach that stage early than what I
Then
reached
what?
15
Yeah.
years.
Yeah.
And from there, he can excel.
Yeah.
But that, I feel, we are not focused there. We are trying to teach them basics, which is okay, not wrong. But in a way, all these seminars and all, where they are not interested.
Yeah.
This is my
Yeah.
perception.
Yeah.
I may be wrong.
Yeah.
What is your perception as a teacher, and how we can improve it?
Yeah. I feel the role of a teacher now is to be a mentor. Okay. Should a teacher be a friend? Absolutely not. I'm very old school in that. A teacher is a teacher. There has to be a boundary.
Definitely, sir.
Okay. But does that mean you don't, I used to sit with my PGs, talk to them about various things, but there is a boundary which you will not cross. So I think, and also, yes, technology can be a double-edged sword. Yes, I agree. But one thing is that I think the basics have to be taught. Yes, some of it is boring, very boring sometimes. But unless you know those basics, you cannot move forward. Now, as a prosthodontist, I'm one who is quite against the use of complete dentures. And you might wonder why a prosthodontist is saying that. To me, if a patient becomes totally dentulous, it is the failure of the whole dental community,
Correct.
all of us, because we have brought that him or her to that state. That is the reason why I say that I don't like complete dentures. Because what happens? They have done studies and they have found that bone loss increases with complete dentures. So they did a 5-year study where they measured bone, and they found that more bone loss occurred with patients who had dentures than less. That is why I am so passionate about overdentures. See, we have over 110 or 120 million totally dentulous patients in India. And the majority of them don't get even complete dentures, they don't get. But because they have reached that state of total dentulousness, it is a failure on our part. And of course, the patient has a big role in that. I'm not saying no. But this thing of going and extracting teeth, a patient is great to mobile, extract the tooth. That mindset has still not changed. With all the advances that we have in dentistry. And now with implants coming in, it has become even more. Earlier on, people used to try and save teeth more. Now it's like, I can take it out and put an implant inside. And therefore, there is an article which has come out a few years by a European dentist, and the title of that was "Are we doing too many implants?"
Okay.
So I think where our system needs to improve is we are too procedure oriented right now. Even in our examination system, if you look at it, let's look at so I just did a I looked at what MS surgery exam is all about and what an MDS oral surgery, simply because they are both surgical specialties. In an MS surgery, they have their theory papers, and then they have one major case discussion, which is 1 hour, and they have a couple of minor case discussions. And then, of course, the viva and all of those things. And I looked at, and nowhere in the picture is a surgical procedure coming into the picture. They don't have to do any surgical. I looked at the oral surgery exam. Again, same thing, major case, minor cases. And then they have vivas with instruments and x-rays and all that. But there is a clause that says that you can have a minor surgical procedure like an impaction. Why? Why is that required? If you have trained your candidate enough, then why on that exam day, why do they have to do a procedure like that? So let's say I'm not an oral surgeon. Let's bring prostho into the picture. So I looked at the prostho exam system. Same thing, you have your theory papers, and the rest is majorly procedure oriented. Yes, you have case discussion. You have one for complete dentures. You do your case discussion, and then you do a number of steps. Maybe the number of steps have reduced now. You do a fixed partial denture, same thing. You have a case discussion, and then you do a prep, and then you take an impression, and then you show a wax pattern. Why do we have to do all this on an exam day when the candidate is stressed out and may not perform to their? Why not just take some of their completed cases and have a discussion on that? Why did you do this? Why did you do that? Why couldn't you do this? That is a kind of examination system that is more prevalent internationally. I was looking at the US, the American College of Prosthodontics. That's how they have it. They have their theory papers. They will bring in a couple of your cases. They will grill you on those. And there you have your exam system. It is you're graded according to your different subtitles. They will grade you on removable. They will grade you on fixed during your PG.
I agree with that, sir. And what I think is this, well, I don't know, like maybe it's personal experience or maybe it comes down to an individual. What happens here is we are taught to take a lot of stress, during our postgrad, which is okay. It has to be stressful, because the world outside is demanding,
Yeah.
and suddenly we can't just send the students
Yes.
out who can't handle the stress.
Yes, yes.
But I feel that we're never taught to enjoy our work in our post graduation. No, it is always you have to do is for exam. And after one point of time,
Yeah.
there is no exam in your life. And
Yeah.
when this point stops, you are actually learning better without exam,
Yes.
because you really want to learn at that stage. But as a teacher, I feel when you tell a student, you have to learn this because there is an exam, and they are only thinking about
Exactly.
that. And another one thing which you mentioned, that having exams at the end of year doesn't, like at the end of 3 year or 1 year, doesn't take many sense, because the student is only thinking about at the
Yes.
year end. Why can't that is what I feel personally. And trust me, sir, if I look back my undergraduation and post graduation, I have read a lot of books,
Yes.
very strong in basics.
Yes.
So when I say that, is it necessary to teach basics? What I mean is it important to teach these basics based on your seminar? So what I try to convey is, ultimately what I've realized in my life is that I have learned things better by doing cases,
Yes.
sitting with my teacher, mentoring,
Yes.
because I really can correlate.
Yes.
If you look back and at undergraduation, in my second BDS, all thing what was taught to me is amalgam, right? So, and I have imagined inlay, I have imagined all the things. But I have done those things later.
Yeah.
And
Exactly.
I've realized that if I had done those things at that time, did not have to imagine. And I
Exactly.
feel we can learn basics far better doing this way. What changes you feel like you have gone to US and I also gave
Yeah.
US exam,
Yeah.
all those exams are case based.
Case based.
All these
Exactly.
case based
Yes.
exams. They really see whether you are a good clinician.
Clinician. Yes.
And in that process of asking that questions, they basically are checking whether your basics are
Yeah.
strong.
Absolutely.
It's not that they are only checking you as a
Mm.
clinician. There is one point in each case history that if you don't know that point, you will obviously go wrong.
Yes.
So it tests your basics
Yeah.
also.
Yeah.
What changes you would like to do you think the way we teach the students in undergraduation or
Yeah.
post graduation, as you said, it is more procedure driven,
Yes. Exactly.
what would you like to change in today's teaching process?
See, with postgraduates, I had one rule for myself, and this is only for myself, that I would not ask my PG to do anything that I could not do myself. That means I must be better than them in doing that procedure. And this is only me. I'm not talking about anybody else. So if I say that you have not done this properly, then I must do it and show them that this is how it should be done. The same thing for undergraduates. When I feel that most of the time when in Manipal, actually that was groundbreaking. I remember Dr. Vijay Raghavan, very senior oral medicine person. Dr. Vijay Raghavan, every single lecture of his, he would show slides. And that was a big thing at that time. You're talking about the early 1980s. Why? Because he had gone to Libya and he had then, I'm sure he himself was passionate about what he was doing. But there were a lot of other teachers who just write on the blackboard. So you, as a teacher, you have to make it interesting for your students. So I remember initially, you remember those, that what we would call that thing used to write on those transparent sheets.
OCP.
I used to do with that, with my dirty handwriting. And later on, I started doing PPT presentations. You have to show cases to students. You have to go out. If you're saying that you're doing a cast partial, show them a cast partial. Show them how you survey it, even if they're undergraduates. Let them understand. Let them. A lot of undergrads say prosto is so boring. Why? Because we only teach them the most boring part of it. Why? Only complete dentures and acrylic RPTs. Show them every step, how you design, how you survey, so that they understand. They're like, okay, this is what is involved in this. Show them a clinical case. Show them how you take the impression. Show a video of that. Now it's so I record all my videos on my phone. I have either I am learning now how to edit my own videos. They may not be the best, but you know, we need to make it interesting for students. That's the way to do it.
So you like to learn through videos. What has been your experience? What I personally feel, sir. So what happens is when I'm reading from the textbook, I'm only thinking about that one topic.
Yeah.
Okay, another topic comes after 6 months. For example, I can give you one example that as a seminar presentation, I am presenting the working length.
Yes.
Then I am doing the obturation, access opening separately. But in nowhere the student is actually integrating the information.
Exactly. That is the
That
problem.
integration
Yes.
happens when he is doing the cases.
Yes.
But that is much easier by doing case-based learning.
Exactly.
And of course, another way of having the information, integrated information, is by watching the videos.
Absolutely.
You get an integrated information. It's as good as you are sitting with teacher. Of course, sometimes sitting with your teacher and understand it is because there has to be an interaction.
Yes.
But that many teachers are against all this newer teaching methodology, videos, and of course, when I see now, like my son,
Yeah.
he learns things by doing. There are books, there are different books, like if I may, that I got in books called as Horrible Histories, Horrible Science, which teaches about digestive system at the age of 9, 10, which I learnt in 12th
Oh,
standard or
absolutely.
11th standard,
Yeah.
but in a story way.
Yeah.
So I feel the students, they see things in a so interesting way on Insta, videos, YouTube, and we are teaching this boring way of learning, and it doesn't go in. It's as you said, it's not interesting.
Yeah.
But one reason I feel that why teacher not are not open to it. It's not their fault. Even I had that thought that we all have to read things from textbook, which is nice. But I went to US to give NBDE exam, and you know that you can't
Yeah.
carry lot of books, for international travel.
Yeah.
And I came across a channel called as Khan Academy, and
Mm.
trust me, he taught things so nicely, in that 20 minutes or 10 minutes, like biochemistry, Krebs cycle and all. But when I when I read the same thing in undergraduation level, I never
Then
understood which step is
anything.
important.
Yeah, exactly.
I have been author for Dental Bites, contributed to many books, dentist. Ultimately, you need to know the important point from that topic, which will be asked in your exam
Exactly.
also. But when you are teaching, at the end, we have not understood why which point is important. We are
Yeah.
just thinking कि ये question आएगा and we have to write in the exam.
Yeah.
One main reason I feel as a teacher, what I've seen change in me is that as a teacher, when I had given exam, I learned a lot from those videos on
Right.
YouTube and everything. And that is the only time I believed that you can really learn a lot.
Yes.
And we have lot of teachers today, maybe they have not gone through this
Yes.
process. And that is why they think learning through all these things is wrong. Of course, there are videos which are
Yeah.
not academically
Yeah,
right,
exactly.
may not
Yeah.
be 100%
Yeah.
right. My belief as a teacher is many times, even today's, if you see, scoring is very easy today. During our time, even if you knew everything, we were given very low,
Low
marks,
marks,
because the standards were
Yeah.
very, very high. I'm sure
Yeah.
as a teacher, you would expectation was very high
Yeah,
from
yeah.
the student.
True.
Today, getting marks, maybe because this is how it should be. It
Yeah.
should not be like very difficult to
Very,
get
yeah,
marks. Do you believe that this type of teaching may work, or like you went to US also?
Yeah.
What maybe what can you change?
See, regarding videos, now during my post graduation, I was not taught how to do veneers. And I have not attended any course from, although that's a great way of learning. I looked online and I got 5 videos from somebody called Richard Stevenson,
Yeah,
who is
yeah.
a emeritus professor at UCLA.
Correct. Amazing YouTube channel.
Phenomenal videos.
Definitely.
How he shows you each and every step of doing it. That is the best way. See, reading is important because now they have found research to say that what you read goes better into your brain than what you see. So reading is important, no question about that. But I think what you see in good videos, there are lots of rubbish videos out there. If you take up the good videos and watch, I think it really helps. Regarding grading, yeah, it's a very difficult question, I think. The reason I made that reel that you saw was that I saw a couple of videos of, now I don't want to mention names or colleges or anything, of them doing this in the Prostho lab. And I thought, my God, in 40 years, nothing has changed. The same articulator, everything is the same, And then when I went to the US, I saw the DDS candidates there. And I'm talking about 1997. Okay. They had a Whipmix articulator, they had a Henao articulator, and they had a NA surveyor, a DDS candidate. Even our PGs don't have that here. And that's the level of teaching they had in DDS.
But why is that it doesn't happen here? That is what my question. Is it difficult, sir? What I have realized is that it was told to me that this is difficult, this is not your level, you have to be a postgraduate or you have to have an
Yeah.
experience. But what I have realized is that whether you are postgraduate or undergraduate, the time it is, when you start the things, That is when your learning starts.
Exactly.
It's not that after post graduation, people say that inlay is very difficult. You need
Yeah.
to have a lot of experience, but it is very similar
Yeah.
to amalgam preparation. If you tell the student, this is how the outline is, these are the burrs which are different, and guide them,
It's not easy. It's not difficult.
so then why is that some things are set for later stage?
Yeah, I'm not sure why we make it's the same thing. Why in Prosto are we teaching them only complete dentures and partial dentures? Some colleges, I believe, are doing with implants and all that now. Again, this is not about a specific college. I'm just talking very broadly. So, as you say, see, when you go out and you want to be a dentist, what does bachelor of dental surgery mean? That you can do any specialty you want. There is no restriction in India that a BDS person cannot do this or cannot do that. As far as I know, you are allowed to do anything. But I feel that the what we are bringing our candidates out with is not industry standard. I think that is the word we need to use now. That I know I've heard this terminology from a number of a number of engineers and
Yes.
all that. That their training is not industry standard. In dentistry, it is definitely not. The other thing that I saw was that 40 years later, they are using the same, the same. What was that? Toffelmeyer matrix now. I have nothing against it. It's a brilliant matrix system. But it is not designed for composite. It's designed for amalgam.
Correct.
So you are not teaching them what are sectional matrix systems. So definitely when they come out, they have to then update them. They have to go. So a lot of them are saying, we are spending all of this money. Then we have to finish and come down and go for all of these courses to learn all of this.
Correct.
Which is a fact.
But I'm happy to tell you that in our institute, we have introduced loops in second BDS, sectional matrix. Of course, a Palodent V3, which is one type of sectional matrix. In the Garrison, all those, these are quite expensive.
Yes, they are expensive
for undergraduate student. But there are a lot of versions of sectional matrices which are affordable, and we have introduced it in second BDS.
I want to make this thing here. A BDS student is spending X amount, quite a high amount.
Correct.
Adding another 25, 30, 40, 50,000 is not going to make a difference.
Very true.
If they are going to come out, as far as I know, Palodent system is somewhere less than 30,000 rupees.
25,000 rupees.
It's not going to make it that much of a difference.
Yes.
If they learn with that, then they are industry ready.
Correct.
Here, when they come, it is the job of the clinician to train them. And then clinicians say, why do we have to pay them X amount of money and train them to do all of these things? So I'm just talking,
clinician point of view.
Clinician point
what happens outside.
Yeah. So again, loops. I think it's absolutely mandatory to have a good set of loops. But what happens is, again, there are compromises in that. You buy Chinese loops, you buy, loops which don't have good, the optics are not good in the name of being cheap.
Very true.
That is the difference. Like I said, there's no choice. You have to buy all this equipment. Why? Because you will get trained in that, and when you come out, you will be, of course, there also, I'm sure the clinicians will complain that they are not industry, but at least they are so much ahead. Yeah. So I think this has to go. I ask, when I joined as a PG, Dr. Shyam Singh had one very important requirement. I had to have a DSLR camera. And all the, all the preclinical work I did was with gold. My mother cursed me because she had to give me that much of gold.
Okay.
But you need. Why are we telling PGs, no, it's okay, don't buy a pair of loops? No, you have to buy a pair of loops. It is a requirement. You want to do good quality work? You need good equipment. Does good equipment only make you? No, of course not. But you need the good equipment. You need a good handpiece. You need good loops. You need good materials. All of that is required for you to be trained to become a good specialist.
I think there is one problem with when we are young and we are as a student, we can't think 5 years, 10 years down the lane.
So I'm not asking the students to
No,
think. I'm
no.
asking the
As a teacher,
institution to.
I'm
Yeah.
teacher. That is what I'm
Yeah.
coming to, sir. That what happens is when a teacher says something to a student that this matters, the issue being the general tendency, not the current students. Even when I look back, so my brother at various stages have told me that you have to do this, you have to do that. Our general tendency to oppose those things, like if somebody says that no, you buy loop, the students doesn't understand the importance of this 5 years, 10 years down the lane. It's not just student, as a person also,
Yeah.
right? But eventually we realize it.
Yes.
So I would like to give, I read this book also called as Clear Thinking, which has opened when I started reading books. I so many things which opens up your mind, and what it has realized me is that if the student, rather than questioning and objecting to why the teacher is telling me this, because they really can't understand the perspective of a teacher. If they just do what the teacher is saying, they will save a lot of time. And as you know, that quote, time is money, time is everything, which makes sense later.
Yes.
Even though you may not realize it, but you will end up saving a lot of time. So through this podcast medium, I would like to tell my students, all these viewers, that you have a nice mentor who is telling you something that you should do it. Just do it. Do not have a second thought.
Correct.
Because we all have done the same thing.
Yes.
And eventually realize that we will do the same thing eventually. Why not do it today?
Yeah.
So sir, one very clear thing now, since you are from prosthodontics today, if you want to frame a UG curriculum
Mhm.
and a PG curriculum,
Mhm.
so you know that the UG curriculum is, I think, taking impression and border molding as a final
Yeah,
exam.
something
Let us,
like that.
you
Yeah,
know,
yeah.
and in practical also, mostly they are just doing the
Yeah,
teeth
yeah,
setting,
yeah.
or and there is not much of, even in exam sense
Yeah, yeah.
also. In post graduation, I think you may know better, fixed
Yeah.
FPD,
You have, I think,
denture.
some steps in complete denture. FPD, I think prep and impression and a wax pattern. That's what I think.
Okay.
And then I think they survey a cast partial model and some implant work, something to do with that. I mean, I've been out of this for some time now, so I don't know what the current thing is, but this is approximately what it is.
So what would you like? Because you said UCLA students are doing
Yes.
a lot of things.
Yes.
What would you change today? Like in very simple, straightforward, point wise. I want the undergraduate. Let us assume you can't take out the exams from the system.
Yeah. Yeah.
Okay. You have to prepare them for exams.
Yeah. Yeah.
What would you like? What would be the ideal scenario according to you? Or we should be focusing on those things?
I think we should go more into objective questions rather than having these long essays that we have to write. Go into multiple choice questions.
Okay.
And I remember I gave out one of the multiple choice papers that Dr. Bumer had given me. And out of the 5 answers in there, I mean, you did the NBD. All 5 can be correct, 2 can be correct. How is it here? They will make sure that only 1 is correct.
Correct.
You need to have objective, more of those coming into the picture. And you must have more, I feel, on treatment planning rather than having. See, procedures are important. I'm not denying that. But the most important thing, you need to train your, either BDS or MDS, whoever it is how to be able to objectively write down a treatment plan for a patient. That means taking everything into consideration, not just the prostho part.
In the practical wise,
Practical wise, I wouldn't give so much importance to complete dentures. Probably move a little more into cast partials, a little more into implants.
Let
A little more
undergraduate.
into, yeah, I think they should be taught a little bit more. Even if they don't want to do it, at least they should be able to diagnose the case, that this case can be, an overdenture can be done,
Okay.
or I can save all of these teeth. And then this is what I can do with that. And also have these, I'm not sure what they call them, they have case-based scenarios where they keep models or x-rays or something, and you're supposed to then write down that
OSPE.
one.
Yes,
Exactly.
yes,
Yes.
yes. Correct.
So where you actually find out how much that candidate knows.
And post graduation?
Post graduation, rather than spending all this time in making them do all the procedures, take 4 cases that they have done. One full mouth rehab case. Now, when people say full mouth rehab, they automatically assume it is completely crown and bridge. Even a complete denture is a full mouth rehab. So take one, say, overdenture case, one cast partial denture case, one, fixed full mouth case, and get them to present all the, right from the start to the finish, justify everything, and you sit there and critique it. Do 4 cases like that.
Okay.
You don't need to make them do procedures. I feel that if they are not able to perform those procedures, then I think they should not be there in the exam. Why are we assuming that they don't, or why are we looking at whether they can do that procedure on that day when you're stressed out of your head? Obviously, you will make some mistakes over there. If I am having 4 examiners sitting on my head like that, I will be scared. There's a good chance I'll go in and goof it up. Like I said, why don't we take that from the medical community? They don't have, the MS surgery candidate doesn't have to perform a surgery there to know whether he's good enough or not. He needs to justify. Why am I doing that? The internal teachers, like I said, every topic, fixed, removable, whatever, grade them on it.
But then again, this question comes that this framework is set by the council, right? And changing this, not very, lot of colleges are comfortable, implement. Some colleges have done it. They have really changed, how the exams are conducted and trying to fit in the curriculum which is given by the council itself. Do you see things changing in the curriculum? Do you really believe? And now, since there is, a lot of council which is being changed, they are saying that it's gonna, bring changes. Do you really believe things will change in dentistry?
If they get the right people into the council, or they call in experts who think differently, it can change. Anything can change.
But
But whether do they want to do it, that I don't know.
but why is that people don't want to change academics? Do you feel, because see, I have when I see the curriculum,
Yeah.
whatever you all this topic we want to teach, everything is there,
Right.
you like, but it is not the way, there is no clear framework, like it has to be taught in this way. It's very vague,
Yeah.
and it can be interpreted by different colleges or different faculties in a different way.
Yeah.
If I say no, I want it to be taught practically rather than theoretically, some people may agree, some people may not agree. So I think it is very general, and
Yeah.
the intentions of the council, whatever framework, the it is there.
Yeah.
But how we interpret it,
Yeah.
or how we want to bring change, that is where people are, don't want, it's because you don't
Yeah.
want to go against this system or this framework. As of course it's very easy to say as a teacher, but when it comes to a larger picture, you are responsible for all following these guidelines, regulatories for a institute.
See, guidelines can be changed. They're not written in stone. I'll give you an example regarding this. Is a very again, a very controversial topic among prosthodontists regarding spacers. At one time, spacers were like, you had to have a spacer inside. And I never understood why you need a spacer inside, because you put your green stick and that got stuck to the wax and all of those things. I went to UCLA. Dr. Bumer said, "Who told you need spacers?" So he showed me another way of doing it. Just flow some wax on the rugae area, and that's it. But you need a mindset to, you know, and that is the land of Boucher. But they have moved away from Boucher.
Mhm.
You need people who are willing to go against the norm. That's how everything in the world has changed. Somebody has to take the stand and say, listen, it's high time we went, we did something that was better. Yes, there will be people who will object. People object to so many things.
Okay.
Somebody has to bell the cat.
I'm interested, it's almost 40 years since you have completed your education. These questions may be little personal. Do you have any regrets? Because you are 60 years.
Yes.
I'm 40. So, do you feel life could have been slightly different if you like maybe some realization if it had happened earlier, or I would go if there is a chance to go back, I would change how I had lived, or this change little bit. I went wrong here. Some decisions are like if they are not too personal,
Yeah.
something which can help the generation.
Uh, I love being a dentist. There's no question about that. Even after 40 years, I enjoy what I do. I think dentists make a huge difference in people's lives, especially when you think of things like maxillofacial prosthetics. I think the change that you bring, you're really literally giving them back their life after they've gone through this horrific surgery. But I have been fortunate to have excellent people who have trained me. And I have worked with some excellent surgeons, some not so nice people also, but that's okay. I work with some great people now. And so, dentists sometimes feel, oh, I'm not as good as a doctor. No, nothing like that. We work as a team. Where I work now at Narayana, I have never felt, in fact, they consider me a very integral part of that team. So we, as dentists, we always feel that we are less than the doctors. Nothing like that. Absolutely, you should not feel like that. Even if, let's say, okay, maxillofacial prosthetics aside, let's say aesthetics also. I may not agree with everything that is going on in aesthetic, but I have had personal experiences. And of course, I don't claim to be a big aesthetic dentist or anything, but I have done some cases of veneers and all of that, which have been life changing for patients. Really life changing. I mean, they would not look at a mirror and smile, and that person came and cried to me after that. But yes, there is nothing that compares with maxillofacial prosthetics, the kind of change that you make. But there is nothing that we need to feel less than anybody else. We are as good as anybody else is. Things that I could have changed, maybe I could have been a little better student when I was in doing my BDS, I think, probably.
It must have
But
been very difficult, you said.
I failed. Yes. Yeah.
So, what I feel, sir, when you go through this difficult thing, it's very easy to not have hope,
Yeah.
let go, and we suppose somebody is trying to help you at that stage. Again, we don't understand
Yeah.
whether the guy is really trying to help us. It feels like अगर इतना आसान होता तो फिर why I'm not doing it.
Correct.
But we don't have that thought process, uh, how was it? Like, how did you overcome? You could have just simply said, मेरे से
No,
नहीं
it's
होता है.
devastating.
Who
Actually,
helped you?
I would say the two people who stood by me. One was during the BDS time. It was my mother. Of course, I was her pet, so I could do no wrong. That was there.
Okay.
And my family stood by me. Where I am today, a huge part of that is my family, and especially my wife. Um, she has been my, most ardent supporter, and also a huge critic when I needed it. So it's not, but it's she believed in me when a lot of other people didn't. So I must hand that to her. So I think that is very important. Also, a lot of people will not know that I had huge self-confidence problems in my
Okay.
life.
Okay.
Um, there are times even now, that's the thing about maxillofacial prosthetics. It will bring you down to earth like this. Just one case is enough to make you humble.
Mm.
Eat humble pie. You will be stuck. You will not know what to do next. So be humble. That is something that I always tell myself. It just takes one case. You know how it is.
True.
One difficult root canal or any procedure. I'm just giving an example. Is just enough to make us like, okay, now I
It's
need
not
to
that
get, but it's
easy.
not that easy.
Correct.
And there's somebody above.
Very true.
You know, so being humble. I think I'm not always humble, and I wish I was, but. Yeah, that's what it was devastating after my final year. I just thought I was useless.
Is it because of your learning, or it's a attitude, like you felt no, it was easy?
No, I was not a bad student. I studied. I was not a
Okay.
bad student.
Okay. Because
Like I
that
said,
time I believe teachers were there are lot of ego. I
yeah,
trust me. People used to
yeah,
fail student
yeah,
just because he has not spoken nicely to me,
yeah. I didn't. That's why I don't
or
want to
the
bring
apron
up,
is clean.
why. There
Okay,
were
but
reasons
did
for it.
something like you
There
feel
was something like that also.
okay.
Actually,
Even the internal scores
yeah.
used to be feel based
Yes,
during
exactly.
that
That is
time.
the problem. At that time, that was the problem. Yes, I was not. See, I was not great at my handwork,
Hmm.
and a lot of youngsters think that unless they start off brilliant, they will never become good. That's not true.
Mm.
Dentistry is learning based, and I saw this on a reel that a youngster from Australia put out, and he said there are two kinds of dental students. One is somebody you come out and you remember these carvings we had to do. I
Correct.
was horrible at it. Then
Yes.
my classmate did all my carvings
Amazing.
for me.
Some people are amazing
Yeah,
in the work.
yeah. I mean, she could just do this, and I was like, "What is this?" So dentistry is learning based. You need to put the hard work down.
Mm.
You're not going to get it otherwise.
Okay.
They say genius is 2%, the rest is all hard work, something like that.
Mm-hmm.
So I think it's even when I went to the US, it was not all hunky dory. I had to face quite a lot of issues, um, you know. But my professor stood by me. He was good.
Okay.
Um, all of us face, when we stay there, there are issues that all of us face.
Understood.
It's only when I came back after that, and even then, for the first 1 year, I was like, what the hell am I doing here? I had learned all of this stuff and I couldn't do anything.
Correct.
And then I started my practice. I had no idea about practice, nothing.
Yeah, that is what, sir. That is also one thing which is not taught in
Exactly.
what we think in academics. It's the skill which really makes a lot of difference. But this patient comfort, communication, because I feel that the way we talk to patients when we are in academics
Exactly.
and the way we are supposed to talk to,
Yes.
that is not learned,
That is not
and then again you have to come out, spend 1 year, 1.5 year, seeing how you interact with the patient. That's also lacking in
Absolutely.
academics.
I had no idea. I had never done general practice in my life. I
But
had
but
only
you
gone.
said you learned so much. Like as you said, you had seen these articulators, everything. You do come back,
Yes.
and then you were like, you don't have an opportunity to do it.
Absolutely.
So even though because I think this is a very important topic which you can continue discussing now.
Sure.
It's a practice
Yes.
management.
Yeah.
Um, are you saying that see, because many people are scared today, everywhere everybody says there is saturation,
Yes.
this, that. For a youngster, as you came back, you put clinic, you must be having this doubt during
Of
that
course.
time also.
Absolutely. Even then, a lot of people told me, "Oh, why are you starting a practice? There are so many dentists." But there was one dentist I worked with, and I remember I went to him and he told me, "Jacob, don't listen to anybody. Go and start your practice." That was the late Dr. U.V. Prabhu. He was a BDS person from Manipal. He was the only person who gave me a chance to practice with him.
Mhm.
A lot of people around told me, "Don't start your practice." He said, "No, your level of knowledge is different. You should go and start a practice." And then of course my wife also was there and she said, "No,
Ma'am
let's
is a
start."
dentist?
No, she's not a
She's
dentist. Yeah.
okay.
So she's the one who then motivated me, go and start your practice. And of course I was scared. Even now, I don't run my practice like a true private practice.
Mhm.
Because for me, I don't always look at how much I will get back. See, money is extremely important. I have no doubt about that in my mind.
Mhm.
So money you have to generate, otherwise you cannot run your practice. But for me, if I like something, let's take an example of articulating papers. I have 10 varieties of articulating papers in my clinic.
Mhm.
On an average, even now, how many people use good quality articulating paper?
Okay.
So my place is a place where I get to use all of these things.
It's like more of a
It's
learning,
more of a learning
still
center
learning
for
every
me.
day.
And
Trying new
now,
things.
yes, I have, I actually, my associate now over the last 5 years or so, I have been only taking in recently graduated prosthodontists
Mm.
who would like to work with me
Okay.
so that I can then transfer some of this knowledge on to them. And the credit for that goes to my last BDS private practitioner, Dr. Nida. And she came up to me one day and she said, "Sir, you know Instagram?" I said, "I have no clue." I knew what Facebook was. I didn't know what Instagram. She said, "There is something called Instagram. You should start posting your cases there." I said, "No, Nida, I'm not going to do that. It's not right." She said, "No, sir, you're not showing off. You are teaching other people how to try and do."
Mhm.
And she said, "Sir," I said, "I have no idea." She said, "I will do everything for you." So that is how I started my Instagram thing. I have not many, I have about 5,000 odd followers, but 95% of them are either dental students or dentists, young dentists. And so now I put out I put out reels. Recently I put out one on how you make a special tray
Mhm.
and how do you use that to make an impression. Just like you were saying, try and teach people like that. So I like to experiment with not expensive things, but things that we can try out a new material. I couldn't do that before because I didn't have my own place. So if I want to try out, let's say, a new rubber base, I'll try it out.
Mm.
May not work, but that's okay. So that's what for me. The moment I stop being curious, you know, I want to see new things. And the moment I lose the enjoyment of what I'm doing is the day I need to pack up.
Why did you leave academics?
Uh, yeah, good question.
Because you said you
No, I
like.
love teaching.
No, that's what.
I absolutely
If you
loved
are,
it.
if you like teaching so much, then why are you
I
not in
I didn't have
academics?
the opportunities after some time
Okay.
because everybody wanted full time, and I said I will not do full time. I cannot afford to do it full time.
Hmm.
Just like you said, because of the. Once I opened my practice, then I said, I can't spend the whole. I tried for 6 months just working in the evening, and it wasn't working for me.
So you feel The financial gains are far superior as a clinician.
It is definitely much better. Absolutely.
Okay.
Absolutely. Again, I don't know what the current salaries are, but I'm sure
No, it's
that
true. Of course,
Yeah.
you can earn a lot in
Yeah.
practice. But also, do you feel it is become monotonous? Do you feel only clinical practice become monotonous over a
That's
period
why I
of
do all
time?
of these things.
Correct.
You see, I I'm happy that I get invited for conferences. I go and lecture there.
Mm.
You know,
But is
with,
it as impactful as you can be in touch with one-to-one students in
no,
academics?
so that is the reason why there are like I told you, I have young. I also work. We run a practice at Astor CMI. So
Mhm.
four of us together. So I have one recently graduated prosthodontist there with me. I
Okay.
have one with me here. So I teach them. So
Mhm.
it's like um, it's it's nice. I mean, can it be exactly the same as your college thing? No, obviously not.
Many people say that today's students do not have gratitude for teaching.
No,
When you learn from someone, there is no gratitude.
I
Do
don't
you
agree with.
feel any
No,
change in the?
I don't agree with it.
You don't
I
agree.
have never had a bad PG. Never.
No, no, not bad.
Yeah.
The students can be good,
No.
but you put so much effort teaching them. But
Why are we expecting gratitude?
exactly.
Why are we expecting gratitude? But I can tell you this, that I am happy when they meet me in a conference, they come and meet me, they talk to me.
Mhm.
And some of them are nice enough on Teachers' Day to wish me. And
Okay.
that's enough. I don't expect anything from them. I did it because I wanted to do it. Why
So
should we?
what are the some other good things what you felt was not there in your generation? This all discussion is about generation today.
In what way? In my
Anything you see students current generation dentists coming out. One thing you said they are very active with
Oh
technology.
yes,
What are the other qualities you feel if I had these qualities? They're quite fast.
yeah, they are very
They are
fast. Yeah,
quite low. I am feeling it,
yeah, yeah,
I was considered to be
yeah.
good in technology. They are faster than
Yeah,
me.
no, but the good thing about me is because I'm around these youngsters, they
Hmm,
teach me the tech.
correct.
So now I can go in and sort of edit my own videos. I
Okay.
have learnt all this from them.
Good or bad, I don't know. Many people say students are serious नहीं है, उनको कुछ करना ही नहीं है जिंदगी
I'll tell
में.
you something about students. If they know you're on their side, and what I mean by that is not that you're not tough. I don't mean become friends with your student. That is not what I mean.
Okay. What does friend mean? Like,
Like you're not keeping any barriers in between.
mhm. Is
Like
there an example? Any example? Like, can you call them after their age? Like, can you talk to them? How is their, how are they doing
yeah,
after?
yeah. After they graduate,
Correct.
then I become. Even then, it's
More
not
of a colleague
friend.
kind of a
It's
thing.
not a friend, but
Well
it's
wisher.
yeah, absolutely.
Okay.
Like some of them, I've asked them to call me Jacob, and they've flatly said no.
Hmm.
You know, but can they call me for any personal issues? Of course, I'm there. Can I be a friend? Friend? Probably never, because they will not look at it like that.
Very true.
Because I am their mentor.
That's very true. Even in my experience, after teaching 13 years, there's only one student
Yeah.
who have been a really good friend to. Like, and I can
Yeah.
talk to him every
Yeah.
day. I've tried it because I feel as a teacher, it's important that you mentor them after their post graduation with whatever experience
Yes,
you have.
absolutely.
Out of everyone, there is only one student, whom I call once in 2 days or 3 days.
Okay.
He calls me back. I think that closeness doesn't, and when you move up in the ladder, you tend to develop a distance. Maybe that term senior, you are a senior
Yeah.
teacher. Uh, Somehow the students also get scared to approach you because they think senior means, very
Yeah,
serious
yeah,
teacher.
yeah.
So, but in reality, I'm sure at this age also you feel as young
Yeah,
as
yeah. No.
you.
See, one thing that I always tell my PGs or any student, whether undergrad, you can approach me anytime you want and
Hmm.
ask me any question you want. There is no, the problem again in some of our in our system is that if a student challenges you, that is taken personally. They are not being personal at you. Why do we take it so, so personally? They're asking you a question. It's
Hmm.
high time we, broke those kind of things. So a lot of people, students come in, so you are so easy to ask question to. I said, isn't that the job of a teacher? Of course, if somebody asks you too many stupid questions, you are going to this
Yeah.
thing. But that is the role of a teacher.
Okay.
Your job is to mentor them. In abroad, I'm sure you have the same. You are allowed to challenge your professor.
Hmm.
In fact, they want you to challenge them. But here we take it personally. Oh, he's challenging me. So what? He's not challenging you. He's just asking whether this can be done instead of this. That is not a personal challenge.
Hmm.
Why do we take it as that? We have to break some of these mindsets that we have.
Okay. So, apart from the technology, do you see any good qualities, any change which is very obvious, like not technology? Anything else? Do you feel they are different?
Meaning the students?
Yeah, the students who are coming out and practicing with you, do you
No,
think they don't know what they don't know?
yeah. See, compared to when I graduated, I think a lot of them have false sense that, oh, now I have finished my PG and
Hmm.
therefore I know everything. But
Correct.
it's some of them know exactly what it is, and I mean, you're going to fall on your face, unfortunately, because, like I said, the learning starts now.
Hmm.
The real world learning starts now. Yes, you have been taught procedures, but like you said, when you go into a private practice, why is it that? So that is the first thing I tell a lot of youngsters when they come in. You are in completely different setup now. You cannot talk to the patient like you did in college. That should change in college.
Hmm.
You see, that hasn't, that. So when they come into the private practice, the first thing they have to learn is how to interact with patients.
This which is very important.
Yes, that is the most important.
Hmm.
That is in the beginning more important than doing the procedures.
So you are into maxillofacial prosthesis
Yes.
now. How would you incorporate that in the curriculum, or do you feel
You mean in the postgraduate curriculum?
can you do that?
Yes, there are institutions. You see, the main problem with a maxillofacial program is you must be attached to a cancer center,
Hmm.
or you must be able to get cases from a cancer center. So in the US, where I graduated, maxillofacial prosthetics is a separate 1 year program after your
Hmm.
masters in prosthodontics. So you don't do very much in your masters. Maybe you do a little bit, but majority of you do in that 1 year program. That is why I said there are only two institutions, Amrita and TMC in India. We need a lot more institutions training people. But
Okay.
the problem is there is a very small percentage of prosthodontists who want to get into this.
Hmm.
Even now, it's much better
And
when.
why is that?
Well, number one, it is extremely hard work.
Okay.
Because you have to not only deal with the anatomy, you have to deal with the psychology of the patient.
Hmm.
Patient is coming to you, after having all this surgery and radiation, and they are very down psychologically. So you have to deal with that and take care of the So if you're not good in your basics in your prosthodontics, you will never be able to handle a maxillofacial case.
Mhm. And does the technology with the scanners, everything, does it help?
I am personally don't use scanners.
Mhm.
I don't think that scanners are very good at doing functional impressions, which you need in maxillofacial.
Mhm.
But I'm sure that slowly, it is
Things
getting
will improve.
incorporated. Yes. Like if you want to do extraoral cases now, you have facial scanners which can be used.
Correct.
Yeah, slowly it will get incorporated into that.
Mhm.
But what maxillofacial, like I said, it is an absolute life changing, uh, and I've been doing it now for 27 years. When I came back, other than Dr. Chandrasekharan Nair, who was doing it in the government college in Trivandrum and here in Ambedkar, I was the only person who was there.
Mm.
Now there are a lot of people who are getting into it, but we need a lot more training programs in India.
Is possible in 1 year, sir? Is it possible
Yeah,
in 1 year?
it's
1 year
possible.
is possible.
Possible in 1 year, provided you have good teachers. The problem is a lot of our faculty themselves are not trained in
Yeah.
maxillofacial.
I think unless the teacher
Yeah,
is trained, it's very
that's the
difficult
problem.
because then we end up teaching only theoretical
Exactly.
or reluctant to teach.
Yes, because they themselves are not confident in that.
Yeah, and it's very difficult for a teacher to accept that I don't know these
Yes.
things. You know, we feel we become smaller if we say to
Yeah.
the student that we don't know these things. But now, of course, there are so many opportunities to learn if
Yeah.
you don't know.
Yeah.
Mm,
No,
that's
I
just
think you should, I don't know everything. If I don't know something, even if it is in a lecture, I'll tell them, I'm sorry, I don't know. I can find out for you.
Mhm.
Nobody knows everything.
Correct.
If we knew everything, we would be God. We are not.
I remember what question I asked you in the 3M symposium.
Okay.
Uh, I have seen everybody trimming the opposite teeth when
Mhm.
the crown has a high point.
Yes.
So the thing which I remember when you told me during that time also that because you could have said no I don't do all this, but of course that time technology judging everything was. I asked you why is that everybody trims the opposite teeth when you know that the crown your clearance is less. You said it would be wrong on my part to say that I have never done it.
Yes.
You explained how it has to be done, everything. But with technology, I think today you can really judge the clearance much easier.
Yes.
Earlier, even in practice, I have brought that prep gauge, everything.
Right.
But that practice of joining two crowns,
Yes.
and trimming the opposite teeth just because people even today
Yes.
do not understand the significance of die cutting and there is so much
Yeah.
and somewhere I feel it all comes back to your education and
Yeah.
schooling. Because of that all these things is happening and I hope it changes.
I
But it
think
is
your ethics are very important. It's what you are comfortable living with. Have I done something which I shouldn't do? Yes, of course. But would I do it? For a majority of my cases, absolutely not.
what is your view on all these reels which is happening? People are I don't know whether it's right or wrong. Of course, it comes to individuals. Some people enjoy making videos, not educational videos. What I'm saying that um, you must have seen the reels and all where people are
You mean dentists making it?
dentists making very
Okay.
different videos. We all feel it's wrong, but someday we might be there. Some people object it, some people are okay. It's very difficult to comment
Give me an
personally.
example of something.
People are making the general common scenarios which we face with the patients. Do you feel there are some reels which should not have been
Oh,
done?
absolutely. I've seen some dreadful reels. I don't know who these guys are, some technicians or something. They're making these full arch restorations on one abutment. Have you seen those?
Yeah.
I mean, That is dreadful. You
But why
can't
are they
put a,
doing it? Do you think they are not aware that it is wrong? Is it
some
because
of
of
them probably don't know it is wrong, because I'm not sure whether I don't know why they're doing it. I mean, I think we should comment on it and say, this is wrong. I have done it. I mean, nicely, not blasting anybody or anything like that. But
40 years into practice? I'm sure you had ups and downs. What really matters in the long term?
okay, my clinic is 27 years old, so
Okay.
yeah, yeah. See, starting a practice at any time is scary. A lot of people, when I started, like I said, discouraged me. But I think the main things are you need to be have a niche field. For me, it is maxillofacial prosthetics. So I think something niche is required. I feel for that, if you need to go out and do a fellowship or something, and I know everybody can't do that, and I know that everybody wants to make money. Everybody should make money. But I think the way I look at it is that the money is a byproduct of what you do. And therefore, you must be the best at what you do. And then the money will start coming in. So I'm not sure whether that is the right philosophy or not. But,
Mm.
you must be, and you must always compete with yourself. So this is a reel that I saw. And it says you should not bother about other people. Compete with yourself that you are better than what you were yesterday. That's not easy to do. So every day you're competing with yourself. You're not looking. Of course, you are going to look, because now the world is basically on social media now. Uh, you know, but that's the thing that I think looked at myself. Am I better than what I am yesterday? Is there anything that I can do better? And can I do it better than what other people do?
Mm. You went to US. Did you not plan to settle there?
I thought about it, but like I had said, that I had got this Audrey Meyer fellowship,
Mhm.
and one of the criteria for that is you go back to your
Okay.
country.
Okay.
But if I look at it now objectively, um, could I have been successful there? I hope so.
I think you can always go back. There is a clause if you're gone on L1 visa or
Yeah, I
something.
was on J1 visa.
Sorry,
Yeah, I
J1.
was on J1.
You have to 2 years. You have to
Yeah,
be in your country, and then
exactly.
you go
Yeah.
back.
No, but more importantly, I had given my word to Dr. Buma.
Hmm.
For me, that was important. And like I said, if you told Dr. Buma something, then you need to
You
stick by
said
that.
you will
I will
go
come
back.
back. I said
Come
I
back
will
to
come back
India.
to India. And
Okay.
I think I've achieved a lot being here, because I've, you know, got got a whole generation of people interested in maxillofacial prosthetics.
Hmm.
Um, from somebody from almost a zero number, now we have a huge number. I'm not saying that I'm the one who has done that, but I think coming back, training the people, training my colleagues, treating the patients that I did, I think gives me a lot of satisfaction.
Any bad experience in practice? Anything which you could have handled slightly better? Any such experience if you're comfortable, or something which has taught you a lot? That one case which changed your perception.
For the most part, I think Touchwood, I haven't had those kind very bitter issues like that.
Okay.
But there was this full mouth implant case I was doing, and quite a difficult patient. So yes, I did lose my temper a
Okay.
couple of times, and I wish I had not done that.
So do you feel that it's always it's okay to let go, the behavior of the patient, or sometimes you have to be like,
No,
no, or nowadays, no, you feel like if the patient is very demanding, very some demanding is fine, but sometimes patients end up,
Unreasonable.
yeah, and they will come with all
No.
diagnosis and everything. Would you prefer treating such patients, or would you like to not prefer and maintain your peace?
So when a patient comes in with a not just a filling or a crown or something like that, with like you're doing a full mouth kind of situation. If the patient, so the first sitting, I never give the patient a diagnosis.
Hmm.
Never. And I would advise everybody not to do that. No price quotation, no diagnosis, nothing. You are only going to collect records in that appointment. Take photographs, take models, whatever you want. If the patient is unreasonable and they want all of that to be done, like give a quote and give a this thing, and if I feel they are being totally unreasonable, I would say.
But how do you tell them? Like, would you say, no, I can't treat you, or will you?
No, you have to do it subtly and tell
Mhm.
them that, listen, this is the way I work.
Okay.
And if that's not the way it should be done, then I think we should part ways right now.
Mm. And all these reviews, which sometimes they get angry. They don't understand what is the real problem, and
Yeah.
post a bad review for you when your intention was not that. Does it affect you?
I personally feel that this review business should not be there in medicine at all.
Mhm. Okay. Why is it like what do you feel?
Because, like you said, it could be taken in completely a wrong context.
Mm.
So, the best patient even now is word of mouth. How many patients actually come into your practice looking at your reviews? I don't know.
Mhm.
Well, if you have all 5 stars, to me that seems unreasonable. Because don't tell me that even one patient has not given a negative. And yes, I agree. It has happened to me. People come, they don't understand why you're saying this, and they post a bad review for you.
Mhm.
So that is the reason why I feel that I don't know. I'm not very pro review the review process. I don't know. What are your views on that?
I feel one advantage of a review is sometimes if they are genuine, sometimes they are
Yeah,
genuine,
exactly. Mm.
it becomes easier for the patient. The trust process time cuts down. Some otherwise you spend a lot of time in actually explaining everything, and then they will start trusting you. One advantage is there, but of course, as you said, sometimes you are doing it the treatment rather than treatment, we are thinking how the patient
Yeah,
is perceiving us. We are concentrating more on whether he is liking me or no.
exactly.
I think that is where it goes wrong. Of course you can't please everyone, it's very difficult. It's a
See,
sometimes it's
for
a
me,
different
when I
scenario.
started my practice, there was nothing called a review or
Correct.
anything like that.
Correct.
It's only in the last five
Maybe 5
years,
years.
5 years that it has come into the picture.
Yeah.
Would I look at a review if I'm going to a restaurant? Yes, I would. But I would also look at how many of those are actually genuine. Nobody can have 105-star review. To
Correct.
me, that sounds a little
Not possible.
not possible.
True.
So if they have all 5 stars, then my alarm bells will go off also.
Mm.
But would I go to a hospital like that? I doubt very much. We
And
will still
sometimes
ask somebody,
it is I will also like to tell you this, sometimes the patients who have really worked very hard,
Other ones will give you a negative review.
that is also one scenario.
Uh,
Plus they don't feel, they are really happy.
yeah, but
Patients are really happy, but they don't feel that the reviews are also, they don't like giving a review. That's
yeah,
also a major chunk of
yeah,
patients who have treated very nice and happy, would avoid giving you
Yeah,
review.
they don't want to get into
Correct.
that.
And there
Yeah.
are some patients who have misunderstood. Of course,
Yes.
as you said, sometimes who may not have treated them.
Yeah.
They are most likely to post.
Yeah.
So that's also a very difficult
Yeah,
scenario.
exactly.
And even though you have done a lot of good work, but
I know.
what is seen
Yeah.
on the page
Yeah, exactly.
maybe wrong. That is one.
Yeah, so that, yeah, I mean, see, it's like a double-edged sword.
Mhm.
So that's what technology can be used for good, and technology can be misused completely. See, again, I don't want to bring out, about the whole review process, but yeah, it's like that. It's good and bad, I would say.
So do you think in long term, you focusing on one patient, having a small practice, developing a long term relationship, that is a better aspect, or doing like you are not working but you have many patients and many practitioners under you and guiding them, mentoring them, but difficult to control the quality
Yeah.
every time? Which type of
No, for
practice
me,
would
the
you
first
choose?
one works. That's the only
But
way
were
I know.
you in a different kind of practice in some point of time and
No,
then you realize you always were
I
like
was
that?
always. Mine is a small practice. I have 2 chairs. At some point, I thought whether I should expand, and I said no. I said the administrative problems will be too much for me to handle.
What are your hobbies?
Yeah, that's a good question. I don't actually have any physical hobby right now. Well, it's not a hobby, but I go 3 times a week to a physiotherapy center
Okay.
because I developed very bad back pain.
Mhm.
About 4 years ago, I had very severe back pain.
Mm.
And so I go there, and I there's a gym attached to that, so I actually exercise. It's not just this thing.
Understood.
So it's it's not a hobby, but I like it now. It has given me. So what I've decided is till I work, I'm going to keep going there because
And how long you want to work? Is there like this is the time I
yeah,
want to retire from
that's
dentistry?
the retirement is a very scary this thing,
Mm.
because suddenly, I don't know about how you would look at it, but you're much younger than me.
Mhm.
A lot of our self-worth depends on the profession that we are in. I mean, it shouldn't be like that. I understand that. I have read in that you shouldn't equate it, but it is, isn't it? And now that I've hit 60, it dawns on you that, okay, at some point you're going to have to hang up your boots. And
Mm.
then what? That is where my teaching comes in. So I'm hoping that as my practice comes down, that my teaching will somehow, I have to now figure out how I can do a little more teaching at that time. That's the problem with the college system, you see. At 60, I think that is a retirement age.
Yes.
It's
58 to 60.
ridiculous. It's ridiculous. You have all that experience in you. Why should you retire?
Yeah, what about a training center? Do you feel like that's a
See,
good
I
way
would
of?
love to have a training center, but again, I cannot take on the administrative responsibility of that. That's why I tell a lot of people, you want me to come and teach, I'm happy to do it, but I cannot run a training center. I need to go to a training center and I can do the training.
Many people object to a training center, like they say it is against academics. You should not do it. What's your view?
No, I don't agree with that. These kind, we have academies worldwide. It's not an India phenomenon.
Okay.
And you cannot expect that your teaching will teach you everything that there is to learn. So there's no harm in going to a teaching center
Mhm.
where you're taught well. Again, the standards must be monitored.
Mhm.
That you're ethically taught stuff how to do.
Do you think that happens in all training centers,
I don't
or
know
is it?
majority of training centers. I know a few of them.
Mhm.
And the ones I've seen, they're quite ethical in what they teach. I mean, it depends again on the person who is actually doing the training,
Mhm.
how ethical they are in
Okay.
what they do. So it happens in the US, it happens in the UK. You've seen it on YouTube. You have so many of them. and they really teach you well. For example, Richard Stevenson.
Yeah.
I mean, you can see his videos for free. I learned how to do veneers from those 5 videos that he has taught.
Correct.
So you know that he's an ethical guy.
So next 10 years, what's the plan?
For the time being, go on the way I am, hopefully. I want to
Okay.
keep treating patients. I want to keep teaching. And I hope some new opportunities will come out from somewhere where I can go and spend some time and teach. Like I said, I am terrible at administration, so I did think of it. I even have the place for it, but I said no, I will burn my fingers. See, there are some things you are good at and some things you are not good at, and I am not good at administration, so I decided no. So if I get some good place where I can go, I must be able to control the teaching curriculum completely without interference.
Correct.
Then I'm willing to do it. Otherwise, no. And I don't know, when I become 70, we'll see how life is. I hope I can still function at some level of what I am doing now. And, God has been kind. So we'll see what the future brings. Right now, I just want to continue the way I am.
What's the message to the viewers, youngsters who are looking at this podcast?
I've said this before, and I really mean it, that if I can do it, all of you can do it. And that is really from the bottom of my heart, I'm telling you. I came from, from ground up, and put in the hard work that is required. Okay. And I'm sure that at some point you will achieve what you're looking for. Don't run after money. And for me, money is a byproduct of the hard work and the work that I put in. So money will come for sure, but try to do the best that you can do, and I'm sure that you will achieve success.